Hello, everyone, and welcome to my presentation. My name is Araceli, CABALUM, and I am a nurse practitioner. In this video, I will be presenting my innovation project proposal on mobile health application called Evolve, Self-Care, and CBT Coach. The intent of this video is to discuss how this application is relevant to evidence-based practice in mental health care, particularly for individuals who need constant guidance in managing their mental health condition. Excuse me. This video will be answering 5 crucial questions, beginning with the first, which is, what problem will be the innovation solve? Problem the innovation will solve. Mental health remains to be a pressing issue affecting 1 in every 8 people globally, according to World Health Organization 2022. The numbers, however, are becoming more and more of a concern since that there are people who still cannot secure the clinical care that they need. Aside from the elusiveness of care, people struggling with their mental health also have to contend with economic, cultural, and social challenges. Carbonell et al., 2020. Problem the innovation will solve continue. Although the aforementioned challenges to the accessibility of mental health care occur in most parts of the world, minority groups in the United States are especially affected by the insufficient access to mental health care. Turpin et al., 2021. These minority groups include racial and ethnic groups such as African Americans, American Indians, Alaska Natives, Asians and Pacific Islanders, and Hispanics. Members of the LGBTQIA+ community are also affected by the problem, especially those who have issues concerning their identity and rapport with others. Of course, providing adequate mental health care is not an easy feat. The existence of mobile information technology, however, can improve the public knowledge about mental health and even encourage those struggling with their mental health to actively reach out for professional help. Overall, it can be said that the incorporation of technology to mental health care not only further knowledge and compassion regarding mental health, but also reduces the stigmas still prevalent among minority communities. Alem et al., 2020. Moving on now, the next question to be answered is, what is known about this problem? The United States The United States has witnessed the considerable influx of racial and ethnic minorities throughout the years, primarily because of globalization and immigration. Alvarez et al., 2019. Despite the country already becoming more and more of a center of diversity, though racial and ethnic minorities still experience healthcare disparities caused by economic, medical, and social inequities. Turpin et al., 2021. Excuse me. Meanwhile, for sexual minorities, they tend to delay or completely forego reaching for medical care because of negative medical experiences and also the possibility of disclosing their sexual identity to clinical providers. Turpin et al., 2021. Not all are ready to do such, especially if they live in a volatile environment. The ongoing COVID-19 pandemic led to the noticeable decline of healthcare systems around the world. In the United States, the mental health care sector was not spared by the consequences of the pandemic. Excuse me. Minorities in the country have been and continue to be greatly affected by the alarming number of COVID-19 infections and deaths, as well as pandemics related stressors such as unemployment and the absence of healthcare access. Tumir et al., 2022. Then, of course, as mentioned earlier, minorities also have difficulties in reaching out, even though they are aware of the need to do so, because of cultural and social stigmas surrounding them. All these pressures undoubtedly contribute to the deterioration of mental health of racial, ethnic, and sexual minorities. Background of the problem, significance of the problem, health. In 2020, it was discovered that 21% of the US adult population, which is an estimate of 52.9 million, suffered from mental disorders, according to National Alliance on Mental Illness 2022. Observing the demographic characteristics in terms of race or ethnicity, one would notice that Caucasians experience mental illness more. However, there is also a significant growth in number for Hispanic or Latino, Black or African American, mixed race, and Asian from 2019 to 2020. Substance Abuse and Mental Health Services Administration, 2021. The annual prevalence mental illness among the U.S. adult population demographic group are National Alliance on Mental Illness 2022. Now, non-Hispanic Asian consists of 13.99%, non-Hispanic white 22.6%, non-Hispanic Black or African American 17.3%, non-Hispanic American Indian or Alaska Native 18.7%, non-Hispanic mixed multiracial 35.8%, non-Hispanic mixed Hawaiian or other Pacific Islander 16.6%, Hispanic or Latino is 18.4%. However, lesbian, gay, or bisexual consists of 47.4%. Background of the problem, significance of the problem, health. The table shows how many in the thousands were affected by any mental illness from the years 2008 up to 2020. While some racial or ethnic groups did not have a significant increase over the years, it can be explained by the possibility of individuals living with undiagnosed mental illness. Background of the problem, significance of the problem, health. The table shows the prevalence of serious mental illness, or SMI, among members of the LGBTQIA+ community with with the age group of 18 to 25 years old being a great concern because of a sharp rise of SMI over the years. Continue on background of the problem, significance of the problem, social and ethical. Cost and insurance are the primary reasons behind the unmet mental health care needs of the U.S. adult population. For minorities, particularly Asians, structural barriers and stigmas also add to the difficulty of seeking professional help. Center for Behavioral Health Statistics and Quality 2021. Although small compared to others, minorities such as Asians, Hispanic Latinos, and those of mixed race harbor the notion that their treatment would ultimately be of no help. Meanwhile, 27.9% of the members of the LGBT QIA and community aged 29 to 49 have received no treatment. Substance Abuse and Mental Health Services Administration 2020. Continue background of the problem, significance of the problem, financial. Mental health care costs approximately $2.4 trillion annually and will only increase further by the year 2030 with an estimate of $6 trillion, the Lancet Global Health 2020. The United States spends an average of $225 billion of healthcare budget on mental disorders each year, with $210 billion allotted to depression alone. Lerner and Lavelle 2021. The onset of the COVID-19 pandemic only led to higher spending, but still an apparent lack of resources and services. Untreated mental disorders cost an estimate of $300 billion annually due to lost productivity, including absenteeism, employee turnover, and increased medical and disability expenses, according to National Alliance on Mental Illness 2019. Moreover, the burden of disease of mental disorders in the United States is 7.31 disability adjusted life years in 2019, which will only grow year after year, according to Roser and Ritchie 2021. Background of the problem, review of related literature, modifiable mental health care barriers. The persistence of mental disorders among minorities is primarily caused by cultural, economic, and social barriers that hinder them from accessing the care that they need. While racial and ethnical minorities are aware of the growing symptoms of mental disorders, according to Cook et al. 2019. African Americans and Asian Americans, in particular, tend to delay or forgo mental health care due to lack of financial resources and health insurance, limited English proficiency, lack of familiarity with healthcare system and services, and mental health stigma, Lee et al. 2021. There is also the evident distrust towards psychiatric medication among African Americans, influenced by preventive screening delays and also an extensive history of medical treatment, according to Powell et al. 2019, Joshua 2019. The pandemic has forced the world into a standstill. And what with the rising number of COVID-19 cases and also the following social determinants contributing to declining mental health, McKnight, Eiley et al. 2021. Lack of healthcare access, loss of job or income, food insecurity, and housing instability. Loss of job or income is a major threat among minorities, considering that many of them only have a temporary working visa. There is also the employment discrimination experienced by 35% of African American and Native Americans, 25% of Latinos, and 22% of Asians, according to Williams 2018. Food insecurity is a direct result of loss of income or job, and it is known to cause distress among households whose members have been laid off or have had an increase in utility bills, according to Higashi et al. 2022. Successive lockdowns during the COVID-19 pandemic intensified the overall demand for food, and so prices have in turn been increased and shortages became the new reality for underserved community. Housing instability is a particular threat as well as for minorities who are currently unemployed or do not have enough income to fund their necessities. Benfer et al. 2021. Indeed, the COVID-19 pandemic brought along with it dire socioeconomic consequences that continue to negatively impact the psychological well-being of millions living in the United States. Background of the problem, review of related literature, symptom management strategy. The early months during COVID-19 pandemic became challenging for most due to abrupt shift to a new normal. Healthcare experts and government officials had to implement stringent measures such as border closures, lockdowns, and social distancing in order to mitigate the spread of COVID-19 virus. Forced to shelter in place for long periods, many have thought of ways to avoid unnecessary distress, such as avoiding excessive social media exposure, communicating with loved ones, and maintaining a positive outlook by Duan and Zhu 2020. People have been encouraged to adopt healthy and stimulating activities such as regular exercise, yoga, and meditation, prayer, and online learning, and other creative activities, according to Cart All 2020. There are those who rely on mobile health applications geared toward mental health when it comes to managing either depression, anxiety, and or stress during the COVID-19 pandemic. Summers et al. 2021. Although certain mental health disorders require more scientific evaluation, studies have shown that mobile health applications have been effective in managing the growing symptoms that people experience, according to Goldberg et al. 2022, McGee et al. 2018, and Wang et al. 2018. Background of the problem, tested solutions and ineffectiveness. Now, I will move on to the tested solutions in mental health care as access for minorities and how they are regarded as ineffective during the pandemic. The implementation of Affordable Care Act aims to reform the healthcare system by expanding affordable insurance coverage and reducing cost while still being able to provide quality care for patients. Forman 2015. However, disparities within the healthcare system have only increased. Minorities, especially those unable to apply for insurance, are barred from maximizing healthcare services. Buckmuller and Levy 2020. The utilization of emergency services and inpatient facilities allows the acquisition of psychiatric emergency services, including involuntary hospitalization. However, outpatient care will be unlikely after discharge. Therefore, symptoms may become stronger, reducing the changes of remission and better overall functioning. Mongoli et al. 2020. Unconscious bias and stereotypes may also likely occur, resulting to misdiagnose which can turn fatal. Reparative and conversion therapies aim to alter an individual's sexual orientation or gender identity through series of practices. These treatments are considered cruel and inhuman, especially when they are done without consent. Independent Forensic Expert Group 2020. They can induce long-term harmful effects on individuals. Instead of recovering, they would harbor physical and psychological pain. The third question to be answered is, with whom did you collaborate while working on your proposal? Innovative collaboration. In every healthcare project, stakeholder engagement is a process that must not be overlooked or underestimated. This is because stakeholders' engagement promotes shared decision making, data collection, and examination, as well as the dissemination of results. Kim et al. 2018. Of particular significance in this process is identifying the preferences of stakeholders can be incorporated in the project. Ultimately, though, in stakeholder engagement, accessibility for patients and providers must be the priority. The rapid popularization of technology in healthcare has undeniably improved stakeholder engagement as well. Healthcare providers developing innovative projects no longer have to merely stick with traditional means of stakeholder engagement, example, in-person engagement. Nowadays, they can utilize technology in conducting conference calls, online surveys, virtual interviews, and other engagement methods in cyberspace. Kim et al. 2018. Because of this, stakeholder engagement itself has expanded, allowing better perspective for future healthcare projects. Innovative collaboration, stakeholders involved. There are a number of stakeholders in healthcare. That in itself is growing ever more complex. However, the key stakeholders are best remembered as the 4 Ps. And they are the patients, providers, payers, and policymakers. Lubeck 2019. In the innovation project proposal for Evolve Self-Care and CBT Coach, I have decided to consult 2 providers and 1 patient, considering that providers and patients are the target audience of the mobile health application that I have chosen. For the providers, 1 is a therapist promoting telemedicine among her patients, while the other is a social worker who's focused on young adults from underserved communities. I consider the social worker to be a provider because a social worker in general help in coordinating the care of patients. Meanwhile, the patient I consulted is one of the identifies as a member of the LGBTQIA plus community and is currently seeking professional help to recover from childhood trauma. She is also technologically literate, therefore allowing a patient-centered discussion and application accessibility and its connection with increased usage. For the stakeholders that I have interviewed, they stress two important factors that must not be disregarded when developing an innovative project in healthcare, such as mobile health application geared toward the management of one's mental health. These factors are number one, accessibility, and number two, credibility. Accessibility pertains to the affordability of the mobile health application and the availability of the mobile health application's features for patients who opt to utilize the free version. Certain mobile health applications have monthly subscription and or in-app purchases, which can discourage patients who do not wish to worry about additional expenses. For Zoo et al. 2020, aside from discussion and cost, developers of future mobile health application must also look into other accessibility needs like for the sight and the hearing impaired. Overall, navigating a mobile health application should not be too complicated, or this would result to patients being intimidated and discontinuing their usage. As for credibility, this pertains to the need to ensure that the content of the mobile health application actually adhere to evidence-based practice. Otherwise, the mobile health application can become detrimental for users who seek its guidance in self-managing a condition. With that, with that being said, the next question is, what mobile health application did you propose to solve the problem? I have mentioned earlier, utilization of appropriate technology. As I have mentioned earlier, the mobile health application that I have chosen is Evolve Self-Care and CBT Coach. Its key goals are to help users overcome symptoms of anxiety and depression, attain better sleep quality and productivity, and improve their overall mental well-being, according to GTA Solutions LLP 2020. Evolve Self-Care and CBT Coach is geared toward people from all walks of life, and there are features, however, for LGBTQIA plus members as well who are struggling with their identity and social exclusion. Users of Evolve Self-Care and CBT Coach are expected to enjoy a variety of activities developed by healthcare professionals, thereby adhering to the need for mobile health applications to actually be evidence-based. Furthermore, as implied by the name of the mobile health application itself, the activities are based on cognitive behavior or CBT, mindfulness, and dialectical behavioral therapy, DBT. This is according to GTA Solutions LLP 2020. Of course, no mobile health application has been proven to be the ultimate cure for a particular health condition. However, Evolve Self-Care and CBT Coach, as well as others mobile health applications, can help users further understand their current condition and develop better self management techniques. Meanwhile, for the undiagnosed, mobile health applications can encourage them to seek professional help. Evolve self care and CBT coach should be considered as a supplemental to one's journey to recovery. The final question is to be answered: why is your proposed solution innovative? Innovative solutions. In person mental health consultations can be limiting in the sense that not all patients reside near the practice environment of their chosen mental health care professionals. Then there are also the undiagnosed who reside in remote areas or are currently in an environment that makes it rather difficult to talk about mental health care. Mobile health applications like Evolve, Self Care, and CBT Coach make it easier for people who have certain mental health care services within arm's reach while they are in the process of seeking professional help. One must remember, though, that a mobile health application cannot be the sole cure for any condition. Online treatment in various forms, such as mobile health, are largely appealing because of cost effectiveness and time flexibility. It has been observed, though, that they are appropriate for individuals with mild to moderate symptoms of mental illness, according to Becker 2016. And so, as emphasized earlier, Evolved Self Care and CBT Coach should be supplementary to one's treatment. This concludes my presentations on Evolved Self Care and CBT Coach and the growing relevance of mobile health applications, particularly in mental health, in a world that is becoming more and more intertwined with technology advancements. Hopefully, this has helped in expanding the knowledge on mobile health applications who cannot benefit from them. Thank you for listening.